everyone, it's Lorelei here. Welcome back to my YouTube channel. Today I would like to focus on the nursing crisis in Canada. There's no doubt that most of you are aware of the situation that continues to take a toll on nurses every day. However, I feel it is really important to revisit some of the key issues and remind people about the ongoing dilemma facing not only nurses, but frontline workers as well. As you are all aware, probably, the trucker convoy protest is in its 6th day now in Ottawa. Yes, truckers have every right to protest how they feel about the federal government interfering in their lives and mandating vaccinations, etc. However, I have a real problem comprehending whether or not truckers, as well as other anti-vaxxers, are looking at the big picture. If people get sick with COVID-19 or the Omicron variant, the responsibility to take care of these people and make them well falls directly on our medical professionals. So I guess I see this protest as a sort of slap in the face, not only to nurses, but frontline workers as well. How do you feel about all this? At the end of this video, I would love to hear your thoughts or comments below. Nurses are worn out, tired, and trying to figure out what comes next. At the start of the pandemic, everyone on the front lines rallied together to do what was needed to be done to respond to the crisis of COVID-19. Now exhausted clinicians and staff are dealing not only with the trauma of a deadly virus and its effects, but also with the fundamental changes that have been taking place within the profession. COVID has shifted how nursing leadership is talking about career management for their staff. What sort of growth path can they provide for veteran nurses, and how will they approach the large and growing shortage of nurses? In addition to the shrinking number of nurses across the country, programs to train new nurses are also in short supply. The nursing burnout existed long before COVID, however. The past 2 years of COVID has understandably contributed to an increase in the causes and symptoms of burnout. This month, Sonia Bernhardt is giving up her full-time nursing career of 14 years. The St. Joseph's Healthcare Hamilton nurse says chronic understaffing, limited resources, constant overtime, and poor pay fueled by surging rates of the COVID-19 Omicron variant led her to take a part-time role, which will be supplemented with another job that pays $6 less per hour. Bernhard recalls the exact moment that made her realize she couldn't continue working full-time anymore. One of her close friends, a colleague, was assaulted at work. While this alone wasn't enough to force her hand, Bernhard says assaults and violent patients have been growing more common over the past 2 years. The lack of protection and mental health support offered to staff working in such environments meant this was the straw that broke the camel's back. Bernhard says nurses are routinely having to deal with aggressive patients being assaulted and working on wards where they have no training or experience and little support. Despite being aware that the profession needs her now more than ever, she says she simply will no longer work under such dangerous conditions. I'm tired. I'm done, finished, mentally checked out. I am 100% burnt out, Bernhard says. Advocates for the nursing sector are sounding the alarm of an impending public health crisis as burnt out workers like Bernhard take a step back from the profession or consider leaving the sector altogether, as surging rates of Omicron across the country stretch already limited staff to the breaking point. When you add these things together, you get a recipe for a level of burnout which is well beyond anything that we've ever experienced. And it will manifest itself in people leaving in significant numbers, says Michael Hurley, president of the Ontario Council of Hospital Unions. While Canada's nursing shortage was already happening prior to the pandemic, workers and experts say these past 2 years have exacerbated issues that have repeatedly failed to be addressed, including an aging workforce, poor salaries, and the pull of higher paying international jobs. In 2020, Ontario had the lowest nurse per capita ratio in Canada, with 665 registered nurses for every 100,000 people. The Canadian average is 814. A 2019 survey of nurses conducted by the Canadian Federation of Nurses Unions with researchers from the University of Regina revealed that 83% of nurses felt that their institution's core healthcare staff was insufficient to meet patient needs. An additional survey in February 2021 reported that 70% of healthcare workers stated their mental health had worsened during the pandemic. A whopping 96% pointed to workplace demands as the cause of their declining mental health. A 2021 survey of nurses conducted by the Registered Nurses Association of Ontario reported that 4.5% of Ontario nurses plan to retire now or immediately after the pandemic. At least 13% of nurses aged 26 to 35 reported being very likely to leave the profession once the pandemic dies down. Last year, the American Nurses Association did a year one COVID impact assessment of more than 22,000 US nurses and found that 18% intend to leave their jobs within the next 6 months, and 21% are undecided about leaving. Nearly 50% noted that the decision to leave is a result of their work negatively affecting their health and/or well-being. The Ontario government's 1% wage increase cap per year on public sector employees, also known as Bill 124, rubbed further salt in the wound, Bernhardt says. In response to questions about Bill 124, the spokesperson said it was inaccurate to suggest that wages were capped at 1% because employees could still receive salary increases for seniority, performance, or increased qualifications. When asked whether the government would be making further investments in the nursing sector during the Omicron surge, an Ontario government spokesperson said they had already acted swiftly to introduce schemes such as pandemic pay. They also said they took swift action to impose restrictions to blunt transmission and prevent hospitals from becoming overwhelmed, which included canceling non-emergent and non-urgent surgeries. Last November, the Ontario government announced as part of its fall economic statement that it was investing $342 million to add and upgrade the skills of more than 5,000 registered nurses and registered practical nurses and 8,000 personal support workers. Another $57.6 million will go toward hiring 225 more nurse practitioners in long-term care, starting this year. On September 23rd, Quebec announced a $1 billion plan to fix the province's nursing crisis, offering nurses a bonus of between $12,000 and $18,000 to stay in full-time jobs, encouraging part-timers to go full-time, and attracting 4,300 nurses back into the profession. Other provinces across Canada, such as Manitoba and Saskatchewan, have been ramping up calls for assistance to deal with critical nursing shortages. Advocates for the sector fear a looming crisis lies ahead if investment is not funneled into the sector now. The government needs to wake up, reach out to these nurses and say, we need you and we will modify workplaces for you to stay. In short, there needs to be a reckoning throughout the healthcare industry. It is hoped that changes are coming in the longer term. The pandemic has revealed cracks, and leaders are hopeful in the not too distant future that changes will be coming on a scale that we may not have seen otherwise. Lines of communication are opening up in ways that they haven't before. Healthcare leadership realizes that implementing appropriate recognition of the demanding emotional toll of the workload and embedding more meaningful support and flexibility in the operating model can help retain talent on a broader level, instead of nurses leaving Canada to go work somewhere else internationally. Nurses demonstrate their resilience day in and day out, regardless of the situation, even in a pandemic that can sometimes feel like it may never end. So the question is whether or not continued resilience in the face of a COVID reckoning is what is needed to move forward. If you are new to my YouTube channel, don't forget to click the subscribe button down below. It is completely free to do so, and it really helps out my channel. Also, if you like the views, the news, and the educational videos that I provide and find them helpful, please hit the like button down below as well. Just a reminder that if there is anyone you know going through a tough emotional time, I can be reached directly at dynamicsandhealing@gmail.com. Till next time, thank you so much for taking the time to watch this video, and I look forward to seeing you again. Take care.